Your spiritual health matters, don't ignore. Let God revive you at the core.
Hello, people. Thank you so very much for always investing 20, 30 minutes of your time to join me on this platform. And for the last couple of episodes, 2 or 3 episodes thereabout, we've been looking at what we call vital signs. That is, what the signs of a physical healthy body, and we are trying to learn and relate that to a spiritually healthy spirit, as it were. And we've covered a lot of ground working with a very experienced medical doctor. We've talked about temperature, we've talked about pulse rate, we've talked about respiratory rate, we've talked about oxygen saturation and blood pressure being the critical vital signs, the five of such. And today we want to go a little bit outside of that. They are not necessarily the vital sign, but they are additional indicators of health that we believe we can also learn from the spiritual perspective. So once again, I want to bring our medical doctor. He has over 20 years of experience working in surgery, in general medicine, and right now working in, what did you call it? The aspect that has to do with the brain. Anyway, Dr. Adeyinka, you are welcome. Maybe you can help me with that.
Yeah, thank you very much, Babalola. Nice to be back on your platform again. Let me thank the viewers for attending and listening to our conversation. I do hope that you are gaining from this conversation.
Okay, well, welcome. So I was struggling with that word. Help me with that area of specialization that you are doing now that has to do with the mind. What is it called?
Okay, so the mind, the study of the mind is actually divided into two. We have neurology and then we have psychiatry.
Okay, psychiatry.
So I'm actually on the psychiatric aspect of the things.
So that is the
work on the psychiatric.
Yeah, and you are working. Tell me
the psychology and psychiatry.
Okay, the relationship between what and what. Maybe we could start from there. The research you are doing.
So traditionally,
yes.
Traditionally, the human being has been divided into two. We have the body and the mind.
Okay.
And from antiquity, from a long time, people thought that the mind is completely independent of the body. But we now know that they are not completely separate from each other. They are a continuum. Whatsoever affects the body does affect the mind.
Right.
And sometimes whatsoever affects the mind manifests also in the body. So it's not dichotomous. It's not either or. It's just a continuation of the same body system. But generally, even though a lot of things that has to do with the mind also is not only affected with medication, but is also affected by what we call psychological treatments. And a lot of it are behavioral. In fact, I tell people, having come newly to this specialization, I come to that proper upbringing, godly upbringing is best psychological treatment there is. And I'm still yet to be convinced otherwise. So if people are talking about psychology treatment, there are various validated treatment options like CBT, like DBT. We've mentioned mindfulness. There's a lot of things that people do, the psychological therapy that helps people. But I find out that a godly upbringing and godly wisdom is actually better than a lot of this psychological therapy. And they are just spin-off from godly behavior. So yeah, we have a good heritage as Christians. I say that, and I'm never shy to tell people that we
Thank
do
you.
have a godly heritage. We
Yeah.
should not, we should not
Right.
gainsay our heritage in Christ.
Okay, that's very good. Happy to have people like you who have the medical background and also are not ashamed to be associated with the gospel. You are our ambassadors in that kind of environment, especially the Western world. So let's go back to our conversation that we've been having for several episodes. Like I said, we've covered the main vital sign, but there are additional parameters that may show health or otherwise of a human body. And today we want to start by looking at the body mass index. We're actually almost concluding. So maybe you can start by telling us, what is BMI? I've had a number being thrown around, BMI. Can you tell us what that is and how it relates to health?
Right. Thank you, Babalola. So BMI, as you rightly says, is body mass index. And it's a very simple calculation that tells you what an ideal weight should be compared with your height. What the ideal weight should be compared with your height. And for recently, I must say that the BMI is receiving a lot of flack.
Wow.
People say, oh, the BMI is outdated, that BMI is not very representative. I do disagree with those who say that, and I will say the reason why. People who say that, they mention the fact that a lot of people go to the gym now, and when you go to the gym, you build up your muscle. And once you build up your muscle, your BMI will go up.
Really?
It does. And that, your BMI will go up because your weight is gone up because you have built up your muscle, you have done the abs, you have done all the things that you do in the gym, and you are all ripped and all those things. And so for those people, BMI is not very useful. Because the BMI is supposed to measure the amount of fat in the body. And generally, the higher your BMI, the fatter you are. Do you understand that? So that's the idea.
Get it.
And so people who go to the gym, people who go to the gym, they actually now say, oh, BMI doesn't, and that's a valid point. But I ask people, how many people have time to go to the gym and do all those exercises? So for population level, for an average person on the street, the BMI is still very, very important. It's still very validated. Those who are into fitness, who are into being into gym, they have the luxury of discarding the BMI. We have other method of measuring their fat level in that instance. So if you find somebody who is into fitness, then BMI will not be applicable. But for an average you and I have never been to the gym except my daughters, when I take my daughters to go and do their workout. So the BMI effect is for me, it's for my wife. It's probably for you, Babalola, because I don't think you're a gym buff, even though you are very healthy. So BMI is applicable to a lot of people, and we should not just discard that whatever. So usually we say for an average person, we want the BMI to be around 19, let's say 18.5 to 25, thereabouts. That's what we consider an ideal BMI. And the way we calculate it is when we put your weight on it and we calculate your height, it gives you. So we want it to be between 19 and 25.
Correct.
By anything between 25 and 30 is beginning to be overweight. You should begin to watch it.
Mm-hmm.
Anything above 30 is obesity.
Mm.
Now, there is obesity, there is morbidly obese, there is super obese.
Wow.
Nowadays, they say we shouldn't be using that word obesity, that it's whatever, but it is what it is. So there are people who have so much fat on their body, and unless we work together with them, they have that difficulty. If you are someone who, there are other measures of body fat. For example, we measure the abdominal circumference.
Wow.
So when we measure the abdominal circumference, we compare that with the circumference of your hip. So what we call the waist-hip ratio is one of the methods that we can use. We can also use what we call the middle arm circumference. Then we can also use tricep the skin fold thickness. So there are various methods we can use if you don't like your BMI. But generally, BMI is simple. It is easy to calculate. It is applicable for more than 95% of the people on the earth. I think it's a very useful measurement to do.
Okay, that's very interesting, and thank you for simplifying it. And to be honest, I wasn't going to get into the argument of whether BMI is relevant or not. I don't think I'm qualified to do that. But one thing that is very, very clear to everybody is the fact that if you are overweight, even you yourself will know, or it will be obvious, except you don't want to accept. When you are underweight, maybe most of the time one may not know, except it becomes very, very acute. And like we've been doing on this series, my focus is more on the spiritual aspect. You are the expert on the medical side. So is it possible for somebody to be underweight in the spirit or to be obese in the spirit? Is there anything like that?
Yeah. I do think so. I do think you can be underweight. You can be spiritually underweight. You can be spiritually lightweight. I do feel that generally, if you are one of those people who are always fearful of little things. For example, people who are very fearful. They tend to be spiritual. I see it as a sign of spiritually underweight.
Okay.
For example, people who think simple things, they think it is the witches and the wizard are after them. And then, and when people say things like that, I always laugh. That it's because you are not well grounded in the scriptures. Because we know that the gods of the heathen are nothing. And that so there are different ways in which we know that if you are very fearful of village people, of all those things, I'm not going to go very much into that. But on the obese side, some people can be spiritually obese. In which case, the Bible is very, very clear. Second Corinthians told us that we should cast aside every weight and everything that does easily beset us.
Yeah.
So you can be encompassed, you can be encumbered by so much weight, spiritual weight, so that even the things that are not important is what you keep adding to yourself. It is that it's not spiritually beneficial, but you keep adding it to yourself. They said this one is happening there. You wait and join them. There's a doctrine that is raining. You are there. You just keep accumulating all those spiritual garbage. Then you just find out that you are already just making you completely useless. You cannot do things. And it's just also at that side, they find that you are not spiritually wise. You're just adding things that are not necessary onto your spiritual life. So I do like in everything, having a lane, middle of the road approach is the key to spiritual maturity in that aspect. I'll leave it to Babalola to expatiate more on that.
Thank you. I mean, you can be a good pastor if not for your medical career. if they need a pastor in your office, you will make one, to be honest with you. So yes, I personally also believe that it's possible to be underweight spiritually if one is not taking in enough nourishment. Jesus spoke about a parable of a man who went about sowing seeds, obviously like a broadcast method. He sprayed the seeds. Some fell on thorny grounds, in which case it sprang up, but some things choked it up when it was trying to grow. Some fell on hard rock. It didn't have roots. It was like a lot of excitement, but it couldn't. After a while, wind came, sun came, it was scorched, and it died. And then he said, some fell on good ground. So that talks about what exactly do we do with what we hear and what we receive. So how are you able to turn it into energy, similar to what happens in the body? How are you able to use it, turn it into spiritual power, as it were? So that's one of those things. If somebody doesn't read the Bible, for instance, you don't pray, there is no way you will gain weight in the spirit. Let's put it that way. In the olden days, I used to be involved in art, and there was this saying that we turned into like a design. We said 7 days without prayer makes 1 week. And the spelling of the week in this case is W-E-A-K. So if you don't pray consistently for a period of time, you will be weak. 7 days, for instance, without prayer, we say makes 1 week. Or 7 days without reading the Bible, you will be weak. So these are ways by which we can gain weight. Another way by which we can gain weight in the realm of the spirit, and it's similar to what happens in the physical. As a matter of fact, the Apostle Paul says something like, does nature itself not teach you? So we have a lot to learn from the physical things that happen around us. So you go to the gym, what do? They carry weight, they take on responsibility, and they keep making it more. They keep increasing it in a systematic manner. In the same way, if I want to grow, if I want to have weight of substance in the spirit, what do? I take on responsibilities. It could be responsibilities in my local assembly. I do one thing or the other, or responsibility in my family. Like in my family now, I call prayer meeting regularly. That is a lot of responsibility. And I'm almost taking the responsibility of a watchman. Somebody that stays on a high position, prays and senses things before they happen. So there are many, many scriptures that we can use. The Apostle Paul writing said, when there is a time when you ought to have become teachers, and yet you are still babes. He said you need to have increased to the point where you are eating meat and yet you are drinking milk. So we should have enough of spiritual appetite to say, God, I want more. Hunger, for instance, is a sign that will show that we are growing in our spiritual world. So I think that we have a lot of points in that area talking about how we can grow, or the relationship between our physical health and our spiritual health. I think we should move to another indicator of health, which is the blood sugar level. And as usual, let's look at it from the medical perspective before going into the spiritual perspective. So how does blood sugar level indicate health or otherwise?
Okay, so this is also important, and I like the way we started with BMI weight because they are also tied together, and I will try to make the connection in a few minutes. Now, so blood sugar is normally, let's just start with biology. I like taking things from elementary level. Biology, when you take any food, that food is in complex form.
Okay.
So when you take meat, that meat is protein.
Mm.
If you take amala or something, that is complex carbohydrates and all those things. All right. Now, the body breaks it down in our digestive system into the basic elements of that. In carbohydrates, the basic component is sugar, which is glucose. Okay? In protein, the basic element is amino acids.
Okay.
For oil and fat, the basic element, the most basic component is called fatty acid and glycerol. Those are just basic things. So those are the ways, those are the basic element of the food that we eat. And those are the ways those things are absorbed into the body. All right. When you have enough food to eat to meet your normal tissue and cellular activities, all right, that sugar, fatty acid, and all those things are used for body metabolism, body activity, body reaction. If you have eaten enough that you don't need for body metabolism, the body stores them for when you do not have enough. And then, so for example, if you have had enough carbohydrates, the body now stores the excess glucose as what we call glycogen. And so when you are starving, the body will convert the glycogen back to glucose so that you can use. That's the reason why when we are fasting, we don't just drop dead from low blood sugar.
Absolutely.
Because the body is converting the glycogen that we have stored into glucose. However, if we keep eating and eating a lot and there's no way for glycogen to be stored, the body converts every of those things into fat.
Wow.
Yeah. So if you have enough, you've eaten so much carbohydrate and there's nowhere for it to be stored as glycogen again, the body will convert that carbohydrate, that glucose, it will convert it into fat. And that is why people, when they, whatever you eat, it doesn't matter what you eat. If you eat a lot, the way the body stores it is that it converts it into fat. And now, and what fat does is that it interferes. You understand? There's so much there's so much fat that the body can handle. So as the body begins to convert it to fat, the normal measure to maintain the body glucose begins to break down, and your body glucose will begin to rise.
Wow.
Okay? Yeah, the body glucose will begin to rise. So normally, you are eating well, you are eating what is required, the body converts it to glycogen, and you are lean and fit. If you are having too much that the body cannot convert to glycogen, it converts to fat, and that fat is stored in various parts of the body. As you begin to accumulate fat, it begins to interfere with body reaction, and what happens is that glucose regulation becomes impaired and your glucose level starts rising, and so the person begins to have high glucose level. So let me bust one myth. People who says that you can develop diabetes by eating sugar, that is not correct. It's not that you are eating sugar. It's if you have developed, we're talking about type 2 now. You have filled everywhere with so much fat that it is it's not possible to regulate the body glucose. That is what leads to type 2 diabetes. That's a general overview of this. And we find it so that people who are type 2 diabetic on medication, if they are able to drop their weight, they are able to drop that excess weight, whatever weight they use to drop it, the type 2 diabetes disappears. Yeah, it disappears. So type 2 diabetes is a disease of high BMI, which is do you understand that?
Yeah, I get it.
Right.
We spoke about BMI earlier.
Generally, some people, and I see that a lot in Nigeria, they will just test somebody's blood sugar and say, oh, your blood sugar is high, so you are diabetic. That is not correct. A better test to use is what we call glycosylated hemoglobin, which measures how your blood sugar has been over the past 2 to 6 weeks to 3 months. Glycosylated hemoglobin. And if your glycosylated hemoglobin is persistently high, that means you are likely developing diabetes start. Do you understand that?
Absolutely. I get it. And if I'm going to look at it from my layman perspective, basically, the human body and life in general does not allow you to keep taking in without burning it or using it appropriately. That's where I see it. Is that correct?
That's right.
Yeah. So
that's right.
If I look at it from a spiritual perspective, it's not right. There are people who go to seminars upon seminars, listen to sermons, but they don't apply it or they don't obey it. They just keep storing and storing. It may not. Excuse me?
Right, you're back.
Yes. So I was saying that in the spiritual world also, if somebody keeps listening, acquiring knowledge, going from one seminar to the other, podcast, devotional, sermons, but is not applying it, somehow, somewhere is going to result in some sort of disease that may not show the way a type 2 diabetes will show, for instance, but the person will also be abnormal. For instance, somebody may be critical. He didn't say it well. He didn't do it well. But what are you doing? When you give it to them to do, they practice. That is when they will know that it's easier said than done. So that's why James in his epistle says, don't be merely hearers alone, and in doing so you deceive yourself, but be doers of the word. And he likens somebody who is just listening but is not doing to somebody who is in front of a mirror. You see the mirror, and then once you leave, you don't remember what's in the mirror. So we must be people who are doers. We must focus on doing what we are hearing. It's good to have hunger for the word, to listen and all those, but we must not just store it up for knowledge. Knowledge, the Bible says, puffs up. So our knowledge must turn to action. That is something that I always say on this program. So I'm encouraging everybody to make sure that our knowledge turns to action. I think we should talk about cholesterol, which is another indicator of health. Maybe you want to help us a little bit. I know there is bad cholesterol, there is good cholesterol. Give us a little bit of insight, even though we are running out of time to talk about cholesterol, and then we'll wrap it up.
It's interesting because cholesterol is one condition in which our knowledge is changing. Our knowledge of that of cholesterol is actually changing. There was a time in which we thought a lot of the cholesterol is what we eat. Now we believe that a lot of the cholesterol is produced primarily in the liver. But you are quite right. There are some good cholesterol, which is high HDL, and some one which we think is not very good, the LDL. Now, the thing about cholesterol generally is that there are some people that are born who are genetically predisposed to high cholesterol.
Wow.
Those ones, there's nothing much you can do about it.
Okay.
But generally, those ones, you have to go on medication. There are very effective medications to treat those who are genetically predisposed to high cholesterol in that instance. However, for those who are just like an average you and I, who do not have genetic predisposition, the best advice we tend to give people is to maintain a healthy diet and a healthy lifestyle. Healthy diet, healthy lifestyle, that includes good exercise, just as you have elucidated before. And there's not, I don't believe there's anything much we can do in our dietary intake. Once you don't just go on and start consuming fat and all those things, in that instance. But having a very good lifestyle is particularly good in maintaining a healthy cholesterol level. That is the cholesterol is implicated in a lot of conditions. It's implicated in people suffering stroke. It's implicated in a lot of people with heart attack. It's implicated in a lot of people with problem with their blood vessels, people who have gangrene of the leg and all those things. So having a very good, and I must say something, I've said it before, one of the things that work together with cholesterol to cause trouble is smoking. And I so much thank God that we do not smoke very much in Nigeria, because smoking together with cholesterol is a deadly combination. I will leave Babalola to wrap it up and then give this perspective.
Yeah, thank you very much. And again, I'm amazed at how much there is a relationship between the physical body and the spiritual body, as it were, or our spiritual life. Because you're talking of cholesterol, bad cholesterol. My little understanding tells me that cholesterol has potential, bad cholesterol actually has the potential to clog arteries, which can now lead to several of those negative disease conditions that we've spoken about. Again, my focus is on the spiritual side. In the same way, there are things that we can liken to negative emotions. Our emotions are a part of our mind and they are given to us by God. But if we are not careful, the negative ones may hinder us. Things like limiting beliefs, whether about yourself or your environment, or things like bitterness, pride. Somebody calls it stinking thinking wrongly, negative thought pattern. And the Bible talks about pulling down strongholds. I think it's 2 Corinthians 10, verse 24. The weapons of our warfare are not carnal, but they are mighty through God to the pulling down of strongholds, casting down imagination and every high thing that exalts itself against the knowledge of God. So the strongholds are in our mind, limitations, things that help success or failure actually start in the mind. And if we're not careful, the negative, the bad cholesterol can accumulate over a period of time, so much so that we are not able to do anything. For instance, if one is faced with a challenge, what is the first way of thinking? Are you thinking of possibility, positive, or you are thinking defeat? That is a function of what level of cholesterol do you have? Is it bad? Is your artery being clogged? And I'm speaking spiritually from this perspective. So we've spoken about the blood being the life of the human being. It's also in the Bible. But if the spiritual blood is not able to flow because the arteries are clogged with bad cholesterol, which are negative emotions in this case, then there is a big problem that is looming. So my encouragement to whoever is hearing me, watching me, is the fact that you've got to detox. If you have negative emotions, identify it. I've mentioned some of them: pride, lust, envy, unforgiveness, toxic thinking. We need to clean it out. That is the only way that the blood, the life stream, can flow in our bodies and our spirit can become healthy. I think this is where I would like us to pause this particular episode. I want to thank the doctor who has been so much useful to us. Thank you so very much. I couldn't have done this without you. I want to say a big thank you to you for helping us on this series of teachings. To my
You're welcome.
viewers, yeah, I will come again when I need you. In the meantime, thank you so very much. And my viewers, I will continue in this series of teachings. Just stay tuned to this platform, same station, same time. Until then, put to practice the things that you are learning. God bless you.